Let's Talk About Health. It's nice to catch up again after our last session 2 weeks ago. I'm your host, I'm Mrs. Winnie Ohinekisi, and you are warmly welcome. We are live on Facebook and YouTube. As most of you will probably be aware, October is Breast Cancer Awareness Month, and I think it's a worldwide event. So tonight we have a very, very special edition of Let's Talk About Health. But before we do this, let's take a sponsor and then we'll be right back.
At World Remit, we understand what the journey is about. How it can sometimes take a little distance to bring us a little closer together. With ways to save more when you send more, World Remit is here for you, so you can be there for them.
Welcome back. 2 weeks ago, we had a group here who were looking into maternal mortality and morbidity rates in Ghana. And we had the Trailbridge Foundation members here, and they took us through all their activities in Ghana. And I must say that they are doing an incredible job of how we can actually help the people in Ghana in maternal health services. They will definitely need our support, especially in kind, probably in cash, but definitely do go on their website, Trailbridge Foundation, and donate so that we can all help to improve maternal services in Ghana. Tonight we will go straight into our session, and we are looking into breast care awareness or breast cancer awareness, and this has been drummed in so many times in so many places and through all the media. And I have a special guest who happened to be my senior actually, and she had already left when I actually went to Infants Mangel. So big sister, you are very welcome to Let's Talk About Health. I have had the privilege of listening to you, but I'm sure the guests out there will be keen to hear your story. So can you just start by telling us your name and what has brought you here this evening?
Thank you, Winnie, and thank you, Omega TV, for having me on the show. My name is Harriet Nsowa, and I'm on the show to talk about my journey with breast cancer. And I hope that it will be inspiring and it will be encouraging also for all of you. I'll start by saying about 5 years ago, or maybe 6 years ago, I was having a conversation with a friend, and she told me that she had to go and have a mammogram. So I got a bit shaken back, and I asked her, why? Do you have a lump? Is anything wrong? And she said, no. I've been invited, and it's automatic that before or by the age of 50, you get an invitation letter to have a mammogram. So that's when I said to her, I haven't received one. So the very next day, I called my surgery. The nurse was very nice, and she was very encouraging. She said, don't worry, Mrs. Nsowa, you're on the system. You're not lost in the system. It's not uncommon not to receive an invitation by 50. Some people receive it earlier, others receive it later. In my case, I received it later. So it was December of 2013. I was 53 by then when I got the letter. The appointment was for the 23rd of December. And then I'm thinking, it's 2 days before Christmas. I haven't even done my Christmas shopping. Do I go for this appointment or do I cancel? And my sister was also going to Ghana for Christmas on the same day, and I'd agreed to take her to the airport. But then I had a look at the times and I realized I could actually do both. So I dropped her off at the airport and I went and had my mammogram.
So prior to this appointment, you had absolutely no symptoms whatsoever?
None whatsoever.
Right.
Maybe I wasn't doing the self check well, but even after the mammogram, I didn't feel anything. But you know how painful when you know the mammogram machine, how it just flattens your
I know
boobs.
because I've done it. I've done
How it
so
flattens
I know,
your boobs. Yeah, so it's quite painful. But I had no symptoms whatsoever. I had no pain. I didn't feel a lump. There was no discharge from the nipple. So to me, it was just an ordinary, a routine mammogram.
No, any change in terms of how your breast looked at the time?
I wouldn't say. I wouldn't say because I don't have very big boobs. But after my fourth child, I realized that I had gained a good size.
Right.
But no, there was no lump. I don't think it was due to that.
Yeah, and
Yes.
would you remember having regular checks by yourself? Because that's what they encourage us to do.
They encourage
isn't it?
us, but I have to tell you that I don't think, maybe in a whole year I probably would have done it once. And I'm sure that I was not doing it right.
Right.
Because I did not feel anything.
So your whole journey started after the mammogram.
Yes.
Tell us what happened.
Yes. So I had the mammogram on the 23rd of December. And then the very first week of January, I received a letter. And it was a recall letter. They call it a recall letter. And it said something showed up on the mammogram. So they would like to call me back to have another mammogram and a scan. And then in the same letter, the letter said 5 and 100 that get tested will be recalled.
Okay.
So not to panic. So the appointment was for the 8th of January. So I went ahead. I had the mammogram and I had the scan. I still hadn't felt anything. I was confident that nothing was wrong.
Nothing was wrong.
Because like I said, I did not feel any lump, and I may have been doing it wrong, examining myself not the right way, but I did not feel anything.
Yeah.
Yes.
At what point then did all this journey start? Because
Well,
soon you will find out that's a whole life-changing experience,
yes.
isn't it?
Oh yes. After the second, the recall, in fact, about maybe 3 or so days later, I got another letter that called me back, and they said, yes, something showed up on the scan. So they would like to do a biopsy.
Okay.
So I went in about 3 days later. And then that is when I started feeling something can't be right, because, this appointment from the last one and then calling me back for the biopsy, it's too close. So probably something's not right.
Right.
So I went and I had the biopsy done. I have to say it wasn't a pleasant experience. You're done under local anesthetic, but it's still not pleasant. It's painful.
Right. Between having the mammogram, having the first call back,
Yes.
and having the biopsy, what sort of information had you been given? Was there any scare of that we've seen something that is worth?
No, they didn't make me feel like they'd seen something, because in that letter that invited me, the third letter that invited me for the biopsy also said 1 in 5 will be called back, and 1 in 5 will get cancer. The 5 that will be called back, 1 will get cancer. But don't worry.
Don't worry.
They always add that, so they don't want you to panic.
Yeah.
So I still did not panic, because I said to myself, I'm not going to be that 1 in the 5.
Right.
So this is just routine.
Yeah. And then
The only person, by this time I hadn't told anyone.
Anyone at all?
The only person I called after the biopsy was my best friend, Patina Blankson. She lives in Hastings.
Okay.
Excuse me, I called her and she said, you have to tell Eric, my husband. She said, you have to tell him. It's not fair, because if the biopsy comes back, the pathology report comes back and it's cancer, then, you know, it would have been like I've hidden all this from him. So it's not fair.
Why did you actually have reservations in?
Because I wasn't going to be that 1 in 5.
Right.
I wasn't going to be the one that got the cancer.
Denial, you would say?
I wouldn't even say denial, but I was very confident that no, it can't be me, because
can't be me.
I feel like I don't drink. I've never drank. I don't smoke. I may not always eat the right foods.
Yeah.
I may not always exercise, but I feel that, you know, I just felt quite healthy.
Yeah.
So, you know, within me, honestly, I did not panic.
Yeah.
Because it couldn't be me. You know.
If not, why not? Yeah.
Yes.
So, did you go with your family to this biopsy
No,
appointment?
because I hadn't told anyone.
Right.
So I went by myself because to me there was nothing to report.
Okay.
Even after the biopsy. You see, so that is what people will say denial, will call denial, but
Yeah.
maybe now it seems like it's denial, but I don't think that, that's how I felt.
And then the results
And then
came.
the results came. So
Right.
anyway, it was on a Thursday, we went to a funeral. My husband and I went to a funeral on a Saturday. On the way back, that's when I told him. And anybody who knows my husband knows that he's very emotional, so he broke down. But anyway, I told him, don't worry, I'm not going to be that one in the 5. So that's okay. The appointment was on a Tuesday after the Thursday to go for the results. I got a call back from the hospital on the Monday telling me not to come on the Tuesday because doctors were running late, going through results. So to come on the Wednesday. In the meantime, Patina had taken time off work to come down on Tuesday to go with me. So I called her, I said, don't worry, it's been cancelled. She said, no, I'll come back. So anyway, she came down, we had retail therapy, we had lunch, we had a good time, and she went back to Hastings. So next morning, I went with Eric, and a general nurse actually saw us to a room. She took us to a room, and then she was followed by 3 other people. 2 were in nurse's uniform, one was in her own clothes, and then she introduced herself as a doctor. And then the 2 nurses were breast care nurses. So that's when I said in my head, I didn't say anything. It doesn't take 4 people to deliver good news. So this can't be good news. So anyway, after the doctor introduced herself, she said to me, I'm going to go straight to the point. We have examined your pathology results, and I'm sorry to say, Mrs. Nsoa, you have cancer, and it has spread to your lymph nodes under your arm.
Wow.
Yes. So this is how she delivered the news to us.
By this time, you had your husband with you.
I had him with me, yes.
And Bettina.
And Patina had to go back on Tuesday,
So
because
she wasn't
the appointment
with you.
had been postponed to Wednesday, and she'd only taken Tuesday off work. So she came down and we just had a good day out, and then she went back to Hastings. So on the Wednesday, I went with my husband,
Yeah.
and then we got the news.
How did you take it?
I probably was in shock, because I have to be very honest with you. It was like telling me I have a headache. I did not react to it at all. I mean, people will break down, because you go to that room and it's full of boxes of tissues, because they know that it's news that will, you
Bring
end up,
people
yes,
down.
exactly,
Yeah.
it brings people down and you end up crying. But I didn't. And Eric didn't talk, because I knew that if he said anything, it would be tears, So anyway, the doctor, she said what she had to say, and she went. So the breast care nurses, they took me to another room, and that's when they started talking to me about my journey, what's going to happen, what I should expect. I mean, I was given a whole literature of, breast cancer, what's going to happen to me, the different options of treatments that I have, but they cannot tell me until I've gone through a series of tests, a series of examinations through like MRI scans, CT scans, X-rays, blood tests, you name it. In 3 weeks, from the top of my head to the soles of my feet, every inch of my body had gone through some kind of machine.
Wow.
Because they needed to be sure that it hadn't spread to any other parts of the body or the organs.
Yeah.
So, but when the results came back, it came that it was only in my armpits.
Yeah.
It had spread to the lymph nodes. But then that means also that it's not good. It was a grade 3. They graded it as a grade 3.
Right.
Okay, so I had to see the surgeon. He went through the pathology results with me again. This time I had my sister with me and my husband also. And I have to say, still everything was just going over my head, because he's telling me that this is an aggressive cancer, and it's a good thing that they've caught it in time. Even though it's spread to the my underarm, it's still, good. They caught it at a really, really good time. So he said, okay, he's going to book me for the operation. It's a lumpectomy. What he's saying on the screen looks like it's going to be a lumpectomy. A lumpectomy is where they just remove there's the tumor. They don't remove the breast, they save the breast. But he said that sometimes, even though we've told you we're going to do a lumpectomy, when we go in, we probably find that it's more than it was showing on the screen. So we may have to remove your breast, have a mastectomy.
Right.
Yes.
So, by lumpectomy, obviously there was a palpable lump.
Yes.
But at this stage, you still had not palpated anything at all.
Nothing. What they said
Nothing.
was actually the position of it was the reason I didn't feel anything.
Yeah.
It was only detected, it was only picked up by the mammogram, the scans, and the biopsy. But physical examination I would not have felt anything.
Right.
Yes, so that is why I missed it. But it's a good thing that when I got that invitation letter, I honored it. Because if I had postponed it, God knows where I'll be now.
That's probably the greatest advice we can give to anyone, isn't it?
I always
To honor
say that, exactly. You must honor
that.
ladies.
Yeah.
And I know that there are a small percentage of men that also get breast cancer. But please, women, I'm pleading with you. When you get that invitation letter to have a mammogram, don't burn it. There's nothing more important than your life, your health. Because, I mean, after all that is said and done, obviously I organized an emergency bring and share family meeting at my house. So, they brought food, they brought drinks, we had a good time, and then I had to announce it to them. Now, why I'm pleading with all of you to have the mammogram is you don't want to see the fear on the faces of your loved ones, the anxiety, and also the anger. It's like, why my mom, why my auntie, why my sister? The anxiety, the fear, the tears. You don't want your loved ones to go through that. It's not a pleasant journey.
Yeah.
So anyway, I mean, by now I've had the operation.
By now you've had the operation. So
Yes.
the difference between this and some of the other programs out there is we want the health experience to come out. What people should expect when they go to these tertiary institutions for treatment. And that is of paramount importance to me. So that is what we want to take time to go through. You've had the mammogram, you've had a biopsy, and now you are about to start treatment.
Yes.
What happened?
I had a break after the operation. I had a break of 3 weeks, and I had to see my oncologist. And she told me that because of the kind of cancer that I have, she will recommend chemotherapy and radiotherapy.
Right.
So she went through all the results and all the different options, and decided that the best drug to treat my kind of cancer is called FEC-T. FEC-T, there are 4 different drugs. I can't tell you, I mean, I know the names, but that's such long names. It's FEC-T.
Right.
Yes, very powerful.
Just one type of cancer drug. Yeah?
No, there are 4 different drugs.
It is 4.
Yes, so the
Okay.
FECT, the initials
It's
of
a
the drugs.
combination.
It's a combination
Okay.
of 4 drugs that they're going to be treating me with. So yes, and then the day before you have your first cycle of chemo, you have to have a blood test because they have to be sure that your white blood count is high enough, it's safe enough for you to go through the chemo, because chemo is a poison to the system.
Yeah.
So God so good, my blood count was good. So
Yeah.
my doctor,
You
gave
were
the go
good to
ahead.
go.
Yeah, I was good
Just
to
out
go.
of interest, did you have any underlying health conditions at all? Were you
No.
on any other medication?
I don't
Nothing.
even remember the last time that I even went to hospital.
Wow. Right.
Honestly, or even saw my GP until then.
Okay. Right.
So I had nothing.
Nothing
No,
at all. No blood
no.
pressure.
No, no, no.
Whatsoever. So that must have come as a shock to
Yes.
the system.
Oh yes.
Right.
It came as a shock to everyone because they know that I like to lead a healthy life. So how did this happen to me?
Yeah.
Yes.
Yeah.
So anyway, yes, I went along, and my lazy veins, they call it, lazy. I had the laziest veins. They tried everything to get the IV line in because the chemo is delivered through an IV line. So they had to soak my hands in hot water. They had to
Were
wrap
you
my
admitted?
At World Remit, we understand what the journey is about, how it can sometimes take a little distance to bring us a little closer together. With ways to save more when you send more, World Remit is here for you, so you can be there for them. At World Remit, we understand what the journey is about, how it can sometimes take a little distance to bring us a little closer together. With ways to save more when you send more, World Remit is here for you, so you can be there for them.
Welcome back. We had a little technical hitch, so we had to have an interlude. So so far we are doing really good. So we are about to start treatment at this stage. Yeah, and they are trying to find veins, and you are going to go into hospital on a day case basis.
It's a day case, yes.
Right.
It's a day case because I was well enough, because there are some people that actually get admitted because they're very poorly, but I was well enough. But don't forget, that's my first one. I haven't had any, so that's the very first one. But before the chemo starts, you're given all this medication, anti-sickness, so many painkillers ahead of even in anticipation, because they know what's going to happen. So anyway, eventually they did find a vein, and then they put the line in, and then they administered the drug. So it was about 4 bags, and it's so slow. So my first visit must have taken between 4 and 6 hours.
Wow.
Yes. So I mean, it was all done, completed, and then I could go home. But when you're going home, you're given so many tablets, and in the first week, you can be taking up to 30. It's not different tablets, but a total of maybe 30 tablets a day, because of all the side effects that they know that you could experience, which I did, and more and rare. So anyway, before I left the hospital, I started feeling sick, and I'm thinking, is it in my mind, or is the chemo, am I already experiencing the side effect of the chemo? I started feeling sick, but I mean, I kept it to myself, and so we got home. And then also, I forgot to tell you, I'm running ahead of myself. When I had the operation, I was in hospital for 4 days, and then when I was discharged, I was given an injection because the chemo would affect my bones.
Right. So you've had an operation before you started chemo?
Yes, with me they had to, yes.
Shall we go back then?
Okay.
To your experience having the operation, because I think that is what I want people to expect. You know.
Yes. Yes.
This is quite common, common condition we are talking about, isn't it? Breast cancer.
Yes, it is. Breast cancer is
it's
common,
just people don't talk about it.
People don't talk about it.
So how was your experience in hospital?
On the day of the operation, it was 22nd of February, I was to get to the hospital at 7 a.m. My pastor actually picked us up, myself and my husband, and he took us to St. George. All this is happening at St. George's Hospital. And so he took us, and then when you get there, as usual, you have to sign all these consent forms, and then you have to have the ID band on your wrist, both wrists. They have to check that at your name, hospital number. I'm sure you know what I'm talking about. Yes. So, I mean, the room was full of people, but it wasn't all cancer patients. It was different, but it was like people waiting to have operations. So one by one, they were calling people. 7 a.m. We got that 10 to, and you can't have anything to eat also.
No.
So, it was about 12 noon, and I said, have I been forgotten again? And, he looked on the system, and the sister looked on the system, and she said, no, you haven't. When the surgeon is ready for you, they'll come and get you. So they came and got me at 2:30. But this time, Barbara was there, Eric was there, my pastor was there, Reverend Arlington was there. And I even told him to go home because he had to keep topping up his parking meter. But he said, no, I've brought you this far. Until they've taken you in, I'm not leaving. So anyway, they took me in, and they said to my family, as soon as I come out of the theater and I go to recovery, they'll give them a call so that they can come and see that everything's well. So they went home. They were waiting and waiting. 10 o'clock. I mean, my operation took, I think, almost 4 hours because I think they said there was some problem. But anyway, they took me to recovery, and I just wasn't coming round. They didn't understand why I wasn't coming round, but it took a very long time. So it wasn't until around 10 o'clock that I started coming around. So they called my family because they had promised, and they had to honor that promise that they would call them so they can come and see me just to be sure that everything is okay, So they came, I was hooked on all these lines, gadgets you can imagine. And then there was a drain is put in your breast and under your arm, because apparently where the site of the incision, where the lump was, where the tumor was, it leaves a hole, and the body has to fill out that hole. So the tube is inserted so that it can drain that fluid that is collecting under the skin of where the incision site.
Yeah.
So I was also hooked to this tube to drain the fluid. And in fact, if I had come around earlier, they would have sent me home the same day with the tube. Yeah.
Okay.
But because obviously, 10:30, 11, they couldn't discharge me. So, but come the next day, I was gravely ill. I had a temperature. They did not understand it. I had very high temperature. So obviously they had to try and bring the temperature. Luckily, I still had the IV line in, so they gave me all these painkillers and all the antibiotics and everything through the IV line. So I was in hospital from Friday to Monday. I was discharged on Monday.
Okay.
On Monday, they took out the drain. But apparently, usually when they put the drain in and they send you home, the drain is kept in for at least a week. But the hospital, they were happy that no more fluid was going to collect.
Right.
So they took out the drain and they sent me home with all the medication and everything. So we went home, and I was in obviously you're a nurse and you know, I was in a lot of pain, but I had painkillers. And then I woke up and I was in a pool of blood, because where the incision was, the incision site, fluid had collected under the skin at that site.
Right.
And it needed to come out. So the fluid and the blood all came out through the stitches.
Wow.
So I was just dripping with blood. It was quite scary. So immediately we had to call the ambulance.
Yeah. I think you've provided us with a lot of, visual stuff you want people to see. And you haven't relented at all in going all out to do this for the public to, be in the know of the experiences that people go through. And I think I am totally like amazed by what you've done with that. So I can show some of the pictures. I think it's showing now.
Okay, this is what I'm talking about. This is immediately after I was discharged, and I came home, and that's where the fluid has collected. That's blood pouring down the side, my right side. So immediately the ambulance had to be called, and I was taken straight to the ward, and they couldn't insert the tube again, because then I would get an infection.
Yeah.
So what they had to do was they had to use a syringe to drain it.
Okay.
Yes. So I was in hospital for a few hours, maybe half a day. And then when they were happy that they had drained all the fluid through using the syringe, they sent me home. But 2 days later, the same thing happened. Again. Right. So I went back to the hospital. And my breast care nurse, she also had to syringe it out again. So it was like for the next couple of weeks, I was going to hospital like every other day to have it drained.
Right.
It wasn't a good experience. It was very painful.
How long did it take for that to heal? All the wounds from the operation to heal?
Oh, because of the setback, I'll say that maybe about 6 weeks.
Okay.
Because of the setback. So because I had to keep going and having it dressed, because it just kept filling up the site of the incision. It just kept filling up fluid under the skin. That was very uncomfortable.
And I can imagine you were on a lot of antibiotic cover as well.
Because of obviously infection and painkillers. Painkillers is what you call, the painkillers was PRN, what you call as and when.
Needed,
yes, as needed. Yes, so the painkillers was PRN. But I was in a lot of, anti-sickness, because my head was in the toilet. In fact, that first cycle, what I went through, the doctors were amazed, because apparently sometimes it takes the second cycle to go through all of that.
So now we've bridged the gap between healing from your wounds from the surgery, and we are on chemo now.
We're on chemo now.
Started chemotherapy.
I've started chemo now. Yes, I've started chemotherapy.
How many cycles of chemotherapy were you meant to have?
6 cycles,
6 cycles?
every 3 weeks. because they do it every 3 weeks, because first of all the drug is extremely powerful, and so for the first week you're knocked out. You have absolutely no energy. You are lethargic. You can't eat. You're constantly sick. Anything makes you sick. You're taking all these anti-sickness. Then you get mouth ulcers. Your mouth is sore.
And it's that quick?
It is that quick.
Wow.
Well, for me.
For you?
Yes, it was that quick. Yes.
Yeah.
Come the second week, then everything starts to subside and you're almost feeling normal. Almost. So by the third week, you know, you've got some energy. Then it starts all over again.
Yeah. One thing I've noticed is you just had a lumpectomy and then they took some tissues out of your axilla.
Yes.
Isn't it? But your breast was saved.
My breast was saved.
Yeah.
Yes.
What was the reason for that kind of management?
Well, because they said it hadn't spread throughout the whole breast.
So,
because before the operation also, I had to go and have a wire inserted. This wire actually borders around where the tumor is, so that when the surgeons go in, they know which breast. They know that they're working on the correct breast, because I mean some people have had the wrong breast taken away.
Yeah. So we are showing pictures now of
no, this is radiotherapy, so that we can talk about yes
so
later.
we haven't even got to
no
the
no
stage
no
yet.
no.
So the chemo, you never really had any visual side effects as such from the chemotherapy?
I did, but I think I told you that it just took me one day to delete everything, because I took one look at it and I said to myself, do I really need to keep all these pictures? Because everything is in my head. It's never going to go away.
Yeah.
I don't need a reminder. That's why I don't have photos. But I stumbled upon these when I was going through my photos, when you invited
Right. So
me.
we will come to those photos and people will get to know how an incredible resolve you have. Honestly,
you have to be.
You have to be.
You have to be.
Right.
You
So you've had so many cycles of chemotherapy now.
No, I've had the first one. So I went for the second one. The second one, they also struggled to get a line in. So then it was decided that I'll be a PICC line will be inserted in my arm for the third cycle, because they managed to get a line in the third time, the second time round. So an appointment was made for me to have the PICC line inserted. Now a PICC line is a tube that is inserted, you know what it is, in the inside of your elbow, up your arm, and then down to your chest next to your heart. So I went and had this PICC line inserted. It was another painful experience.
I can imagine.
It's done under local anesthetic, and the line was 52 centimeters long. And then at the end of the line, you have, like, I call it branches, because they were going to use one for the chemo and the other one for blood, because they didn't want to use the same one. So it's capped, and then you have a sleeve that is put over your arm, and you can't wet that. So you can imagine having a bath. It wasn't that easy, but I soldiered on. But about 2 days after the PICC line was inserted, I was feeling a lot of discomfort. I don't even call it pain now, because by this time, I'm so used to pain, I just like to refer to it as discomfort. So I called the breast care nurse, and she said, yeah, Harriet, you're expected to experience some kind of discomfort, some kind of pain. Just take painkillers and rest as much as you can. It will settle down. 4 or 5 days later, it was the same.
But generally from experience, because I work on people and we use a lot of PICC lines, and normally you should not be having that kind of pain. It is not. It is just there like any other cannula or any other IV access, but not so much pain like you are describing.
It was uncomfortable, but they kept telling me that
it's fine.
And also I had started chemo, so they put it down to me, the pain from the chemo, everything that I was experiencing, it could be chemo related. But about 5 days later, I called the doctor. She was very nice. She's really nice. She said, call me directly, Harriet, if you have any concerns or anything, any issues. So she said, it doesn't sound right. I'm going to make an appointment with the scan department. And then so go straight to the department, and then they'll send you up with the results. So I went to have the scan done on my arm. And you could tell from the radiographer, the technician, you could tell something wasn't right. So I said to her, is everything okay? She said, don't worry, we're going to send the results upstairs to your doctor. So you go upstairs on the 3rd floor. The chemo ward is on the 3rd floor. You go upstairs, your doctor, by the time you get there, would have sent the results up. So I got there and she said, you were right, Harriet. The PICC line, it didn't go through the right vein. So it has to come out. But unfortunately, because of the PICC line, you've developed thrombosis, blood clots in your arm.
Wow.
Yes.
So it's one challenge after
One
another.
challenge after the other.
Yeah, and you beat it all.
Oh, yes.
Fantastic.
You have to.
You have
You
to
have
be.
to. You have people to
Yeah.
live for. You have family. You have loved ones. You cannot give up. It's a hard journey, but you cannot give up. So
Yeah. Is that what we are seeing on the screen? Is that
now
the effects?
these are all no, those are all
The side effects?
the side effects. This is side effect of chemotherapy. The doctors could not explain the reason for that. They said it's one of the rare side effects.
Okay.
So my arm was covered in lumps.
Right.
But the strange thing was that it didn't hurt.
Okay.
It didn't even itch. But it was just lumpy.
Yeah.
Both arms were lumpy. And it lasted throughout the treatment.
Yeah.
And then it just seemed to disappear.
And the usual complication of people having losing their hair and all that, did it all come
I think
straight
we've
away?
been running ahead so fast that I've
Fast.
missed so much out. But yes, it came straight away after my very first cycle. The second week, I had taken out. I had extensions and I'd taken it out, so I braided my own hair. And I woke up and the braided strands were on my pillow. And
Wow.
yes, so I just touched my hair and I pulled one out. And when I did, that's when I saw that it was all coming out. So I just pulled it out. I just pulled it out. I had a bath. It all fell out. And then I just had a shave.
yeah.
Yes.
It-
So
it
this
was
is
that
this
the
this is the
same-
second week. This is
second week after
it's after first cycle.
cycle.
Yes. Every part that you have hair, every part of it, I lost it all. To date, I have no eyebrows. I have no eyelashes because I'm still on oral chemo. So I don't have that. But my head, the hair on my head, my eyebrows, my nose hairs, my armpits, you name it, everywhere you have hair, it all went.
It all went.
By the second week of the first cycle.
Wow.
Yes. And this is a person that has never worn a wig in her lifetime.
Yeah.
But trust me, right now I have so many wigs because people were super generous. And also before your chemo, they made an appointment with a trichologist so that you can choose a wig.
Right.
I have not praised the NHS yet,
You
but
haven't.
thank you. Thank you, NHS.
I'll deliver your message
Oh,
to
please
them.
do. Please do.
Wow.
They are amazing. They
Thank
did an
you.
amazing
Thank
job.
you.
They looked after me really,
Really
really,
well.
really
It
well.
was a good
It
experience.
was, yes, with the NHS, but
With
not
the
with
NHS.
cancer, obviously.
Yeah.
So anyway, I met up with a trichologist, I picked out the color, the shade, the style, everything, and then they went away and they made the wig. And it takes a few months, so they always do the appointment like maybe after your second cycle, so that by the end of the treatment, your wig will be ready.
Ready.
And I have to say, I've never worn that wig because I think it's like it's bad memories.
Right.
It gives me, it tells me why I have it. Even though I have other wigs, that
Yeah.
particular wig that the hospital did for me, I've never worn. I still have it.
Yeah.
I still have it. Yes. So anyway, the PICC line came out. And then the treatment for the blood clots, the thrombosis, was daily injections in my stomach.
Yeah.
For
Blood thinning medication.
Blood thinning
to
medication.
dissolve
I think
the
it was
blood.
heparin. Yes, for 6 months every day.
Wow.
So when I had the PICC line removed, they gave me the first injection in the hospital. It was in the afternoon, and they said I have to inject the same time every day.
Yeah.
So for the first week, I was going to St. George's every day to have the injection. And the last 2 days before, they actually taught me how to do it, and they watched me do it. And they were happy that I could do it.
Did it delay your the
No,
remaining cycles?
it
didn't.
They didn't delay it because, Dr. Keller has said, Harriet, we're going to go ahead with the treatments. I cannot afford to delay.
Right.
So we went ahead. So, I'm receiving chemo. I'm injecting my stomach. I'm going through all sorts. And another thing that I missed also, I had cataract on my right eye. But then every time I had a side test, they said to me, it hasn't matured enough to have it removed. The moment I was diagnosed with cancer, an appointment was made. I saw the doctor, the eye doctor, on Monday, and Tuesday they took out the cataract because apparently the chemo would have blinded me. I would have gone blind in that right eye.
Okay, so that cataract was not related to any of the treatments at all?
It wasn't related to any of the treatment, but because I had it, it had to be removed before I started chemo.
All right.
But like I said, this is the same cataract that, for about 3 years prior, they've been telling me it hasn't matured enough to have it removed. But at the mention of cancer, immediately an appointment was made for me. I saw the doctor on Monday, next day, Tuesday. It had been removed because it had to be done before chemo started. So anyway, that was done. Now, because the PICC line had been removed, every time, 2 hours before I have my treatment, yes, I have to go downstairs to venous access department. Now, venous access, you will know, is a scan. They use a scan to look for a vein, and the vein guides the needle. The scan guides the needle into the vein, so that you can never go wrong. And once they've inserted the line, they all scan it again to make sure that it's in the right place. But before every treatment, a day before, you have to do a blood test to make sure that your white count is at a good and safe level. Mine dropped to below 1 after the first cycle. So in fact, I was in hospital. It was overnight, and they were even talking about blood transfusion. But they managed to pump me with a lot of fluids, and and it came up to about 3. So I was discharged the next day, and since then it's been at 3 or 3.5. It hasn't gone up. But Dr. Keller said it's safe. We have to go ahead. We cannot delay treatment. So treatment went ahead. And then, so like I said, every 2 hours before my treatment, I have to go downstairs, and then they will insert the line, and then I'll go through with the chemo. Yes.
So you finished the chemo, and that still wasn't the end of it?
That wasn't. In fact, my nails was...
So I think we have more pictures to show.
The nails, that was a result of the chemo.
The chemo?
Yes.
Wow.
Because I'm not a light-skinned person, but I was black. My whole system, my whole body, my tongue, the palms.
Is that what we are
that
seeing
is what you're seeing. That is from the chemo. Your whole body, every part of your body is black. And the nails actually did fall off.
They all fell off
eventually.
All
fell off. I don't have photos of it, but it was sore. So just imagine that every single nail has fallen off the nail bed. So I was given this lotion that I had to apply daily just to soothe it. Because for as long as I was receiving chemo, this was going to happen. There was nothing they could do.
Nothing, absolutely,
there was absolutely nothing they could do about it. So I soldiered on. Because I had to.
You are an amazing warrior.
I had to.
You had to.
And my go-to verse, I think, is Romans 8:18 is, the pain that you're going through now, the joy that you're going to receive at the end of it is worth it. Something to that effect.
Yeah.
It's like, don't worry about the pain that you're going through now, because there's joy at the end of it.
End.
Yes.
Yeah, light at the end of
there's
the tunnel.
Light at the end of the tunnel.
Let's dive into radiotherapy. I mean,
yes.
After
so
all
I finished.
This, you would have that should be enough.
No, because it had spread to my lymph nodes, I had to receive radiotherapy. So I had a 6-week break, and then the radiotherapy. I think I was at Royal Marsden, Chelsea in Fulham. Yeah. So that's where I went for my radiotherapy. But before I went, the day before my treatment started, I had to go and have my breast tattooed. Not the tattoo as you know it, but it's these markers that they put around the area that has to receive the radiation therapy.
Okay.
Because they cannot afford to, first of all,
go to any healthy tissue.
Yes, and also maybe treat the wrong breast. So I had to go. It's not painful. It's not. They just put. No, it's not. It's not. It's just a little, uncomfortable, but it's not painful.
After all the pain you've endured, your threshold was probably very high.
Exactly,
so
and
you could cope.
And I knew that, like you said, there was light at the end of the tunnel.
Yeah, definitely.
There was light. There was joy coming after my pain. Yes. So they put markers around the area that was to receive the radiation therapy. And then I went home. And so the next day, but radiotherapy was going to be 23 sessions every single day. So it was for 5 weeks. You only get the weekend off.
Okay.
Saturday and Sunday. And then it starts again. Monday, Tuesday, Wednesday, Thursday, Friday. So the first week wasn't too bad. But then I noticed I started feeling this burning sensation on my breast. The second week, a nurse took some liking to me. So after every radiotherapy treatment, she'll take me to a treatment room and she'll soak my breast and my underarm with saline, just to, it's like
cold saline.
Yes.
Just to cool it down.
Just to cool it down. It wouldn't stop the burn, but it cools it down, and I think it slows it also. And so she did this for the second week, and then she gave me the saline to take home and said, to do it when I get home. That helped, but it didn't stop the burn. It didn't stop the soreness. It was very painful because, you're going every day. The treatment itself takes about 15 to 20 minutes tops, but it's the preparation before the treatment, because they put you on this couch before they, press the buttons while you go into the machine. So there are about 3 radiographers, and they have to make sure that the radiation therapy equipment, it's aimed at the treatment site, because they cannot, like I said, go outside of it. The tattoos that was the markers, you cannot see with your naked eye.
Okay.
Yes, but their system picks it up. So it's like a highlighter. I think when they shine it, they can see the highlighted areas that needs to receive the treatment. So there's about 3 of them. And sometimes they have to poke me, they have to put cushions under my arm, just to get it right, because they cannot go outside of that area. So once it's done, they leave the room, they leave me on my own, and they go to another room, because radiation, it's not good for other people, if you're not receiving treatment. So they are in another room, but they can talk to me, through the mic. I can hear them, and it takes about, but the couch is cold. So you're covered with a blanket.
I see.
Because, the couch is very, very cold. So, you're in this thing all by yourself in this tube. And then within 15, 20 minutes, it's over. And then I have another session with this nurse for about another hour to cool it down. So this went on for 5 weeks.
Wow.
And I finished treatment first week in November.
The same year.
The same year. But when you are diagnosed with, because you were asking me how I felt, it's a roller coaster of emotions, because you don't know how to feel. You don't even know that what you're hearing is right. Is this a dream and is this real? So anyway, you're given like a 12-month treatment plan, because that is how long it can take.
12 months.
Yes, a treatment plan. So obviously I had to give up work also.
I see.
But another thing that is super important is your support network. I had an amazing group of friends, my family, my sisters, and the generosity of my church members, everybody, my support team. I've seen this saying that cancer is lonely. I don't know what they mean by that, because I was never lonely. I always had people around me. People came over. They brought shopping. They did cleaning. They would take maybe my youngest out. I was spoiled. I didn't cook. There was always more than enough for everyone to eat.
Yeah.
So the support network is very important, because I even volunteered to be a chemo buddy for one lady that I met at the treatment ward in St. George's, because I noticed that she was all by herself. But just as I was finishing, she was starting.
I see.
So we talked.
You had all the experience to share.
Well, yeah, and so I accompanied her on 2 occasions, but the other times I wasn't available. But she was so grateful, because she says even though she's got family, they're not interested.
So you've had this treatment plan, like
yes.
rigorous plan.
Oh yes.
You've beaten everything that came along, all the complications, you've dealt with it. When did you get the all clear?
the all clear I got in March.
So that was a year.
Yes,
after.
yes, it was exactly a year. Because people ask me, how do I calculate my anniversary? In fact, we call it cancerversary. And I say I calculated from the day that I saw my oncologist. And on that day, I received 3 letters to my name. N-E-D. No evidence of disease.
Wow.
No evidence of disease. N-E-D. Hallelujah. Praise the Lord. Yes.
Wow.
So my doctor, she was extremely happy with the result. But you're not out of the woods yet. You still have to go for yearly. In fact, I think for the first 2 years, the 6 monthly checkups, the blood test to make sure that everything is okay. I also had to do a series of blood tests to make sure that the blood clots had all disappeared from my arm.
Yeah.
And after 6 months, when I did the blood test, I was also given the all clear that everything had disappeared from my arm. And I was good to do as I pleased. But because I had lymph nodes removed from under my arm, I can't have blood pressure taken, or even yes, in my right arm. I can't have it taken because it's very painful. I still have a lot of discomfort in my breast, and sometimes, and in fact, after the operation, now is the time that I'm feeling the lump. But they say it's
Really?
scar tissue.
It's scar tissue.
That's what they're saying.
Definitely.
That's what they're saying, because I've had so many mammograms. Because several times I'll go to my GP and I'll say, you know, this doesn't feel right. I'm feverish. I'm feeling like there's something wrong. She will examine. She will feel the lump, but she also says that she thinks it's scar tissue. But just for peace of mind, just go and have a mammogram. And they've all come back clear. They've all come back clear. All the margins are clear.
Wonderful.
So there's no evidence of disease. And
diet was an issue.
Yeah.
Once you started the treatment.
It was. Yes.
It was an issue, wasn't
it? Because your tongue is black. Your mouth is sore. Your gums are sore. It's painful. Anything that touches your gum just sets you vomiting. So the only thing that I could eat, and my Ghanaian viewers will know what it is, was Fanti Kinke. I call it Fanti Kinke smoothie.
Yeah.
So I had a good friend from church.
It's amazing that, isn't
I'm
it?
telling you.
I can't even
yes.
believe that.
That was the only thing. So I had a good friend from church, Elena, and there's a lady that does Fanti Kinke. So she would order it, and then every Sunday after church, she'll collect it, she'll bring it, and then she'll put it through the smoothie maker, and then they'll bottle it. The only way that I could eat was to put 2 straws together, not side by side, but I will insert a second straw into the first one to make it longer. Okay. Put it in the bottle of the Fanti Kinke smoothie and actually put it directly into my throat, because I didn't want to touch in my tongue, because if it did, I'll just bring everything out. And that was the only thing that I could keep down. And you know the strange thing about it? I didn't lose that much weight.
Really?
I only lost about half a stone.
Okay.
And Dr. Keller is looking at me and thinking, Ari, your positivity is what has, kept you alive. Because you have gone through so many side effects, even the rare ones you have experienced. And you come and you're smiling. And you haven't lost weight. Excuse me, some people, after the first cycle, they give up. But you have persevered. You have soldiered on. And I'm so proud of you. So this doctor has become a personal friend. So when I have any worries, I can just call her directly and she'll sort me out.
I think you probably have a very wide friendship network.
I do. I think because of the work that I do.
Because of the
yes.
kind of work that you do. And I was a friend, actually, without even knowing that
yes.
we were related by way of school and all that.
Yeah.
And you actually knew my big sis very well as well,
yes.
and a personal friend and all that. Yeah. So, but these people, you say, have been tremendous in helping aiding your recovery, isn't it?
Yes.
Yeah, your church and
my church, my friends. There's a platform. We have a platform. We call ourselves Bible Scholars Club. Everybody was, even the financial donations, because I had to give up work. So obviously, I lost wages. But another company that I haven't mentioned, I don't even know if this is a company, but Macmillan Cancer.
Yeah.
Another group of people. I cannot thank them and praise them enough.
Wow.
But you see, every time people say that things happen for a reason, because 11 years prior to being diagnosed with cancer, I used to donate to Macmillan Cancer.
I see.
And at that time, I didn't even know anyone with cancer. I just saw a program on, and I decided that this is a worthy cause, so let me donate monthly to them.
Yeah,
So-
I think one thing we have to encourage our people to do, because
Yes,
we
exactly.
hardly take part in these kind of
Yes.
ventures, donating to
Yes.
support worthy causes.
Exactly.
And that's one of your main reasons why
Yes.
you are here. And another thing I've noticed is I've had a number of patient accounts before. I've had Amma Fools in
Yes,
here
yes.
talking about lupus.
Yes.
Mr. Jaja talking about kidney failure. I've
Yes.
had Francisca
Yes.
talking about stroke.
Yes.
And then I had Nanajwa who came here to do sepsis. You happen
Yes.
to watch almost
Yes,
all of
all your
these
programs,
all
that's
of these
correct,
sessions.
yes,
And
yeah.
the resolve of every single one of you going through all these challenging experiences is amazing. It's amazing. And I remember seeing your post on Facebook, and you posted that, oh, breast cancer awareness. And I thought, let me just check on this sister. Maybe she would want to tell her story. And straight away, you said, absolutely, you will do that. Yeah, so I am particularly over the moon. I am so proud. Not just because you are Morgan, but yeah, because you've been very, very strong. But now let's focus a little bit as we draw the curtain.
Yes.
All the different activities that you've been doing to create awareness and to support breast cancer. You were raising trans.
Yeah, it's mainly my church. The first, after I finished treatment, we, instead of Pink Friday, because they do the Pink Friday in October, third week in October, we do Pink Sunday.
Okay.
I should have brought you some photos. So everybody wears pink, and we have a celebration. And then there's a lady in the church. She makes the pink ribbons and she sells them. You have to buy it. She sells them to every church member.
I see.
And then we have a little refreshments at the end of it, and everything is pink. Pink lemonade, pink cake, pink chocolate, you name it. And the way that the church has supported me, apart from my family and friends, is unbelievable. Because the day before I was due to go in for the operation, in fact, I missed that. They came and they held a church service in my home. I was given communion. And then after that, every month, they will come and they will hold a church service. Because obviously I couldn't go out because my blood count was so low that I was prone to infections. So I couldn't, take that chance and go out. So they will come and they will hold a church service. And they never came empty-handed. They always had food, drinks, everything. I mean, my home was overloaded. And then, so that is how I raised money. And also, I'm a designer. I sew. So everyone that came to my home, you had to donate. I had the box, because when you sign in to do the Wear It Pink, they send you all these information, the leaflets, and then they send you like a money box.
Okay.
So I had the money box, and you would not leave until you put something in that money box. But this year I've done the gift aid, the Just Given page, and people have been super generous. Apart from them donated on the link, they've also sent money directly to breast cancer, and they've sent me proof of it. Because I said, if you can't send it to me using my link, send it to breast cancer. Because you see, it takes all of these donations for research to go ahead, for a cure to be found. I'm sure you hear it over the TV and radio. 1 in 2 will get cancer. You don't want to see the fear.
1 in 2 women.
Yes.
Worldwide.
That's 50%.
Wow.
So it's close to everybody's home.
Yeah.
Because you don't know.
Than we think.
You see, you don't want to see that fear and anxiety on your loved ones' faces. You don't want to see them crying. You don't want to see them, all anxious because they don't know, is the treatment going to work? Because that was another question we asked the oncologist, that all this treatment, because you hear so many negative things also about chemotherapy and all the treatments. Does it work? And the doctor said, all I can say to you, Harriet, is the percentage of people that survive is higher for those that actually go through the treatment than the percentage that do not
undergo
treatment.
So all this is very necessary.
So to me, it is necessary. But at the end of the day, it's your choice also. You have that choice to either accept or not accept. You know, so...
Yeah. Wonderful. Absolutely. Well, I am stunned by this. So let's see. We have a few people, over 200 people watching us online.
Wow,
and obviously through other media as well.
That's amazing.
And Hannah Johnson says, very powerfully expressed. Woman of God, you probably know
she's
her.
She's our pastor for the women of God. Our platform. Yes.
Yeah, I'm so proud of you. God bless you abundantly. Rodalyn Graham, Rodi Gray, Morgan says you've been brave. You've been so brave, you know, especially when I received the pictures to support. And I am personally amazed at how much people want to share, to educate and to stop others from getting to stages where they cannot be treated or redeemed from whatever is going on. So this is awesome. Of course, AC Hammond is watching Big Sis, and she
Hello,
says,
Big Sis.
you are a real wonder woman. You are
Thank
a real
you.
wonder. Absolutely wonderful. Adelaide Amma Bonnie.
Yes.
So I'm sure these are all
The Morgans.
Morgans, Rebecca Donko, amazing lady. Alberta says, Methodist Hymn Book 511 verse 5. Though painful at present, I think it was from. Oh no, this is just the Methodist Hymn Book. So I was thinking it was supporting your verse. Yeah. But Alberta is also a Morgan actually, because she's always sharing my program, so I know. And then everybody is just saying how amazing you have been. Let me see if I'll capture a few. Barbara Christian is watching as well.
Hello.
I know she was in the US a few months ago. I don't know whether she's in Ghana now, but people all over are saying thanks for sharing. Dinah Jehua, Pia Adraina Asari is watching. It's incredible. Adley says, when Ayuko, oh okay, that's for me. You started it's been special and amazing, and long may your passion for health promotion continue.
Amen. Yes,
thank you.
Continue.
Keep it going. And great messages going on. So before we round off, I mean, I hope people don't just appreciate you for coming to do this, but we will be sharing the links to the donations, because that is more important to you. So what do you want to say? Just talk to them.
Okay. What I will say to you is that please, first and foremost, do regular self-examination. And if you feel that something is not right, go and see the doctor immediately. I've got 3 letters for you also. TLC. T for touch your breasts.
Okay.
L for look for any changes. And C, call your doctor for any changes or concerns. So TLC is not just for tender love and care.
And that's not for the men, is it?
That's not for the men. That's tender love and care. The TLC is for touch, look, and see if there's any change, and go and seek help. Now, when you go and seek help also, please, don't just accept that, don't be brushed off, that you're too young to get cancer. It's probably a cyst. It's nothing. It's your body. So insist on an investigation.
Yeah.
Insist on having it investigated. Insist on having a mammogram. And please don't bend those letters of invitation to have a mammogram. Because early detection saves lives. Early detection saves. You do not want your family to go through what my family went through.
Yeah.
My kids, I've got 5 kids. I have a grandson now. I have a husband. Everybody knows how emotional. Every time, how emotional he is. Every time that I have a treatment, when we come home, he will excuse himself and say, and tell me that he has a few errands. It was after the treatment that his friends told me that, do you know where he was going? We had to meet up with him because he just broke down. Because seeing me suffer, he felt so helpless. He couldn't do anything for me, but I came through, I soldiered on. But he never broke down in front of me. That's why he's not here today, because if he was, he would be a mess. You know, he never broke down, but he was extremely supportive, bathing me when I couldn't. It was unbelievable, because the first night that I came home also, they gave me an injection because my bones are going to get weak from chemo. And the side effect of that injection, you feel like your bones, every single bone in your body is crashing.
Wow.
Crashing. I was screaming. I could hear the kids. You could tell that they were crying too. But nobody came out of their room, because nobody knows how to help. How can they take away the pain? How can I transfer this pain to them? But that was the one time that I screamed, because all this time I hadn't even cried for myself, because I'd been diagnosed with cancer. But that pain was so unbearable. I couldn't control the tears. So I called my breast care nurse. Now, when you are diagnosed with the 2 breast care nurses, they are with you throughout the journey. You can call them anytime. I have their cards anytime. So I called one. Funny enough, both of them are called Alison. So I called one of them, and she said, yes, it's from the injection. Even if you were to come to the hospital, there's absolutely nothing they can do for you. So just take some painkillers and bear with it. It will subside. But this went on for about 2 hours.
Yeah.
Of screaming. Just
Wow.
imagine maybe being crushed under a lorry. That is how it felt. It was like every bone in my body was breaking. Eventually I fell asleep, only to wake up to start vomiting again.
Yeah. Wow. Just looking at the people who are viewing, I
Yeah.
can see people are watching from the US.
Yes, my
Pe-
best
pe-
friend Rebecca Donko.
People are watching from Ghana.
Yeah, that's good.
People are watching from all over the place.
Yes.
You rightly said the NHS were amazing,
They were
and it all
fantastic.
started with that letter.
Yes.
For those who are watching in other places who will never get a letter come
Yes.
through the post
Yes.
to start investigating, what advice have you got for them?
The advice, like I said before, is that do self-examination, and if you feel...
Would you want to show us how to do it?
I
Like-
probably wouldn't be doing it right, so I'd rather not.
Not.
So, but you can make an appointment with your
Point.
nurse,
Okay.
and they will show you how to do it properly.
To do it properly.
Yes, properly. And any sign of discharge from the nipple is not good news.
Yeah.
So you make sure that as soon as you feel any kind of lump in your breast,
Yeah.
you seek medical attention immediately, because it could save your life.
Yeah.
Because, like I said, early detection saves life, and it's treatable if it's detected early.
Early.
But there are some people that they feel the lump and they're scared to go and even have it examined, because they're scared that the results would be the C,
Yeah.
the big C. But it's not every lump that is
Cancerous.
it's
or
some of them are
malignant.
benign. Yes. So please do not be afraid. Do not bin those letters. And like I said, here in this country, I don't know if there's Macmillan in other parts of the world, but apart from
Probably not.
probably not. But what they did was, because of all the hospital journeys, they also gave me money towards my hospital trips, because they know that from this day forth, the hospital is going to be my second home, and it's not going to be cheap
Right.
driving to the hospital, even on public transport. So they were extremely generous. But another thing that was offered also was a free will writing service. I know that a lot of us don't like to write our wills, but it's very, very important. I took them up on that offer. I have made a will, and I have gifted Macmillan in that will. So please, when you write your wills, it doesn't have to be through Macmillan, but please leave a gift in your will for cancer. It doesn't have to be Macmillan.
How do they get to it? What link? Is there any link to share?
Just go to the Macmillan
Macmillan.
Cancer website, and from there they'll tell you how to. But I mean, with will writing services, you can see any solicitor, and I think they'll help you. But because I want it to be about cancer, I would encourage people to go to the Macmillan website, click on the link, and then just write your will and leave a gift. It does. Every little helps. Every little helps. You know, little drops of water make a mighty ocean. So whatever you can leave in your will for
Yeah.
cancer research will be greatly appreciated. So please, women, examine yourself. Seek advice. And it's not all doom and gloom. It's a painful journey. I won't lie about it because, like I said, I have left a lot out because of time. But all I can say is there's light at the end of the tunnel. And like I said, the pain that you've been feeling, I remember it, cannot compare to the joy that is coming.
Yeah.
So the pain is only for a short time. Like they say, weeping happens in the night, but joy comes in the morning. And the one thing also that I want to tell you about St. George's, the cancer department, I forgot, it wasn't all, doom and gloom. They have a pampering session. So towards the end of your treatment, you are invited to this it's called Feel Good, Look Great session. And this session is about, beautifying yourself, making you, giving it, some people lose self-confidence. I'm sure you know that. So it's like building up your confidence. And the products are by top brand. They're donated from top brands. Clinique, Max Factor, Bobby Brown. Oh, so many of them. I tried to write it down. Perfumes, you get makeup, your foundations, your concealers, your powders, your face cleansers, your eye makeup remover, you get perfume, you get lipsticks, you get lip pencils, you get eyebrow pencils, you get mascara, you get so many things. And like I said, these products that have been donated by the top brands, there's Revlon, there's L'Oreal, there's Maybelline, there's Rimmel, there's Max Factor, there's Elizabeth Arden, there's Estee Lauder, there's Bobbi Brown, there's Clinique, there's so many. So these are top. These are top brands that have donated all these products for cancer patients, because they know that you lose your hair on your head, you lose your eyebrows, you lose your lashes. But just to make you feel good, they've donated these products, and these products are not sample sizes. These are 100 ml, 200 ml sizes. And then you're given a toiletry bag and you walk away with about 14 items. And it must be at least a good £400 worth of beauty products that you get to send home with.
Wow.
So, it's like I said, it's not all doom and gloom.
Yeah.
They have this beauty session. And I took them up on that offer. And I'm still using some of the products to date. And the good thing about it is they had products for every skin color, every skin shade. Because my skin color had changed, that's why they invite you for that program towards the end of your treatment, because by then your color probably will be coming back.
Yeah. I'm sure we can go on.
That's true.
And on
yes.
and on.
Yes.
Let me just say that you look absolutely amazing.
Thank you.
you look stunning.
Thank you.
And who would have thought that, you have gone through all these, but you've conquered it all.
I have.
And for that, thumbs up. That's off to
Thank you. Yes.
Awesome session. And that is why I love this, and especially the patient account. Is like having the theory from the professionals, but when the patients come here
firsthand,
it's a totally different ball game altogether. All too soon we've come to the end of another incredible session. If you didn't share this, I think you really need to keep sharing, it.
Please donate. Keep donating,
people.
please.
Keep donating.
Please keep donating.
So
it's
important,
so
because you
important,
can imagine if 50% of women are going to encounter this.
Yes, 1 in 2.
1 in 2. Then we have a long way to go in raising money to support. And I have been posting all these. I think after this, I will be posting it on my page as well for people to donate. Please don't shy away from donating. It doesn't matter whether you are in Ghana or in the US or wherever.
All currencies accepted.
Yeah. So please do well to donate to support cancer research.
Yes, cancer research.
Macmillan nurses.
Yes, Macmillan nurses.
And all the activities.
Yes.
You see, one thing we should probably start looking into is how we can get some of these awesome services back to Ghana in some of the deprived areas. I know people are doing other stuff out there, through their own efforts. Like I mentioned at the start, like Trowbridge is trying to do something for maternal and child to reduce mortality rates and all that. These things can be done.
Yes.
You see, and again, it is not enough to send gadgets back home.
Yes.
They probably will not use it
Yeah.
if you don't back it up with showing them how to
And training. Yes.
to train them and
Yes.
showing them how to use it. All
Yes.
these things are extremely important.
Yes.
But we can go on and on and on.
Oh,
but
yes,
all
I
I
have
will
so
say
many stories,
is,
but
senior,
I hope that I have. I hope that I have inspired people.
you have inspired
I
people
really
from the
hope
comments.
that I have
From
inspired
the comments,
people.
you've inspired so many
Women, please get checked.
Yeah, please do. So on that note, we will say a big thank you to Omega Live TV. They give me the platform to bring you all these educational programs, and I think it's an awesome thing they do, because otherwise how will we reach so many people? And I would also say, if you are a health professional out there, or you are a patient, you want to tell your story, of course, get in touch with me, because I think this will go a long way to encourage people. I say, for health, it's not an entertainment show. It is a health awareness program. So that's why we take so much time. So just, if you don't have time to watch it visually, just play it in the background and listen. Listen to the life-saving information from our patients, from our professionals, and share and share and share. On that note, I don't know what I've got in store for you within the next 2 weeks, but we will definitely keep the show going. The show must go on. So please, COVID numbers are going up again, and you really, really need to do everything to stay safe.
Amen.
Goodbye,
Yes.
and thank you so much for watching. Share. Thank you.
Thank you for having me.
At World Remit, we understand what the journey is about, how it can sometimes take a little distance to bring us a little closer together. With ways to save more when you send more, World Remit is here for you, so you can be there